for proceeding to media questions for approximately 30 minutes. Because we have a slightly modified setup today, we'll start in the room here with questions and then proceed to questions on the line. Dr. Shahab? Sorry, Dr. Shahab, I think you're on mute.
Good afternoon, Karen. Can you hear me now?
Yes, thank you.
Thank you. So, as the news release says, we have 18 new cases, and our active case numbers are 143. And so I just wanted to start by saying that we are entering an important phase of the pandemic response in Saskatchewan. As we continue to move indoors and look forward to Thanksgiving this weekend, I strongly encourage everyone to reset their households, shrink them to immediate family if possible, and reduce gatherings if you do get together, and stick to your extended household. Know and follow the guidelines to keep the event safe. We can see the pressures on other jurisdictions across Canada and the world, and we must learn from them and to keep our own case numbers lower. Most of the recent cases of the past 3 to 4 weeks have been in several clusters and have included in some situations events that are linked to large gatherings, situations where maybe all the guidelines were not being followed as well as they could have been. And we have noticed that also in workplaces and other settings, best practices for mask use are not being observed. So these are important things that we all need to practice going forwards. The most recent outbreak declaration yesterday at a religious gathering in Prince Albert is of particular concern. As a result of this, we are likely to see COVID cases in communities throughout our north and far north. And it is critical that, as per the Saskatchewan Health Authority news release yesterday, that everyone who attended on those dates and at those events self-isolate for 14 days and seek testing if symptomatic. This is critical to prevent further transmission from that event. During the initial pandemic response in the spring, individuals were exceptional in following public health orders, staying home when sick, and socializing in small family groups. And then we all took advantage of the great Saskatchewan summer, and many days still are very nice to be outdoors, where it's easy to physically distance. But we must now return to behaviors that we demonstrated indoors, that we demonstrated so diligently in March and April to keep our case numbers low. We must constantly self-monitor ourselves for symptoms, and even if we have mild symptoms, we must stay home if sick and seek testing. We must wear masks in all public places where we cannot maintain a 2-meter physical distance. This is the time to be vigilant and follow public health measures. But it's also important to look after our mental and physical health, to remain connected with each other, if not physically, but then virtually, especially with people who are not in our immediate household or extended household. It's also important to continue to work with a number of organizations that promote physical activity, including sports that have started very safely, and including now the Saskatchewan Hockey Association, who will be releasing its guidelines soon with a phased-in approach that would enable games to begin this month and increase in numbers as it is safe to do so. Hockey will be handled like all other organizations that have returned to play with public health measures in place. And to date, while there will be sporadic cases in people who participate in hockey, just like in school or in workplaces, we have not seen any widespread transmission associated with sports. And that is especially because everyone is following the guidelines and rules in place. And that will be essential as we move forward to pay attention to those guidelines. It's very important that we all continue to participate in our daily lives, work, school, social events by following those guidelines, and to recommit to that culture of protection for ourselves and our loved ones. Because while no activity is risk-free, these guidelines do help to maintain case numbers low. We all know these best practices, and we need to really focus on maintaining those as we go into the fall. Decisions all of us make now will impact actions that public health will need to take in the coming weeks. Thank you.
Thank you, Dr. Shahab. We'll now go to questions. Lynn, would you like to start?
Can you hear me okay?
I can hear you, thanks.
Okay. Can you specify the number of new cases that are directly related to the Prince Albert outbreak?
So as of this morning, there were 6 cases linked to the outbreak, but another 5 under investigation. So up to 6 confirmed, another 5 under investigation, so possibly 11. But we always know that when we have an event like this, public health obviously reaches out very quickly to anyone who was at that event and encourages anyone who's symptomatic to be tested. So we expect those case numbers to go up. But that is very important because by detecting cases early, the cases can isolate, their close contacts can isolate, and that is the true and tried and tested way of breaking chains of transmission. Thank you.
If you'd like a follow-up?
Sure. And there's been pictures surfacing on social media from that event showing a crowded room, no social distancing, no masks. Is the SHA or the Ministry of Health looking at implementing a fine or other punishment on that organization for that gathering?
Yeah, public health is actively working with the organizers of the event. Our first priority right now is to make sure that we can contact everyone who participated. They must self-isolate, they must seek testing if symptomatic, and be able to give us their further close contacts. That is the priority right now. However, obviously we will be reviewing guidelines, and I think that is really important for all of us. People who organize events have to follow the guidelines, but everyone who attends also has to follow guidelines. Places of worship have been open since March. We have not seen problems with places of worship because they have generally been very diligent and conscientious, promoting virtual services where appropriate, promoting physical distancing among households, mask use, refraining from singing, especially when case numbers are high. And that has really kept our case numbers low. There have been sporadic cases and maybe 1 or 2 transmissions linked to places of worship. And certainly, this is a reminder for all of us that the only way we can, go to places of worship safely is by following the guidance. It's an important reminder for organizers and attendees as well. Thank you.
Thanks. Mark?
Hello. It's been a month since schools reopened. How would you assess the reopen plan for schools, and how much concern does the recent rise in cases that we've seen in schools and the couple outbreaks that we've seen give public health?
So for schools, in general, we always knew that cases in schools will reflect cases in the community. So generally, school reopening has been showing what we expected it to see, namely very few schools have had a single case, and that case has usually been a child or a teacher who acquired COVID while in the community and presented in school. To date, only 2 schools have had more than 1 case, and we have not had evidence of transmission within the school. And out of the, I think, 19 schools with up to 25 total cases, 7 now have, come out on the other side with a child who was unwell and home for 14 days, and there are a few close contacts home for 14 days now back in school. A few schools have taken extra precautions where a few classes have been have gone online, or the entire school in 3 instances have gone online, because in those situations there may have been more than 1 class potentially impacted in terms of exposures. And again, the responses have been balanced, measured, and certainly when we compare ourselves to other provinces, certainly our cases in schools have been on the lower side. But again, it's a reminder for all of us that it starts with parents not sending children to school if they're unwell, staying home till symptoms settle, or seeking testing, and then testing guides further case contact investigation in the school and in the community. Thank you.
Other provinces have seen rising numbers, including their two neighboring provinces. Has the province considered tightening restrictions on travel between provinces, and what would we need to see for that to be implemented? What kind of rise would we need to see?
Yeah, generally we don't recommend non-essential travel to other provinces. Obviously, essential workers have always been able to travel, and they self-monitor and isolate at the first sign of symptoms. If you have an urgent need to travel, you must be aware of where you're going, what are the guidelines there, what is the transmission rate there, how you can keep yourself safe if you have to visit a family member, for example. So I think it is really important for all of us to still think very carefully before we choose to travel to other provinces. Certainly, if you have to travel for some essential purposes, that's certainly permissible, but we need to, I think, defer non-urgent travel at this time. Thank you.
Thank you. We'll now take a caller from the line. Moderator?
We have Laura Scarpelletti from CBC.
Hi there, can you hear me?
Yes, I can. Thank you.
Great. So thank you again. And I'm just wondering if the number of COVID-19 cases that we're now seeing at Holy Cross, if it has kind of increased the province's focus on testing within schools.
I think when we did testing in schools without a case, we did not find any positive cases, so that is very reassuring. And certainly testing is available to schools as required by public health. So usually it's limited to obviously the case who was tested and if close contacts develop symptoms, but testing may also be offered to teachers and students in the entire class or additional classes as appropriate. So that is ongoing in many of the schools through local public health, and the Saskatchewan Health Authority is able to support that by, there's ample capacity to support additional testing as required if a school is impacted. Thank you.
Do you have a follow-up, Laura?
I do, yeah. This is concerning the church in Prince Albert. Are you disappointed or surprised to learn that the church singers went unmasked, considering the places of worship rules have been in place now for several months, and whether more public education is needed?
Yeah, one quick comment I'll just make on testing is that on our website under Safe Schools, we do list the testing numbers in elementary and high school students, and those are significant. And the test positive rate remains very low overall at 0.3. Overall test positive rate in the province is 0.6. So again, our data that's on the website now also shows reassuring signs in terms of sufficient testing happening where required and a low test positive rate. So now coming to your current question, it was about, apologies, could you repeat it, please?
Laura was asking if you were disappointed or surprised with the attendance at the church events, since it has been a number of months that we are into the event. Would more public education be needed at this point? Yeah.
I think this is a reminder for all of us that, our guidelines and our behaviors have served us really well. We flattened the curve in April and May. We remained fairly low in the summer, apart from a few sporadic outbreaks. We will never see zero cases. We will see, low number of cases where we want to be. We will see, even when the guidelines are being followed, we will see occasional clusters and outbreaks. But certainly when there are events where there are initial reports of maybe people were not physically distancing, not wearing a mask where required, I think this is really a reminder for all of us that COVID is still, in Saskatchewan, in Canada, and we have to do everything we can to keep our numbers low, especially as we enter into the fall. So our guidelines are very robust. They've served us really well, but it is the responsibility of all of us to adhere to them, not just the organizers of an event, but also all of us who choose to attend a place of worship or any other business or activity that's allowed. Thank you.
Thank you, Doctor. We'll go to the next caller on the line. Moderator?
We have Nicole D. Donato from CTV.
Hi there. there. So my question, we actually just received confirmation from Preston Park 2 residence home in Saskatchewan that they had two positive COVID-19 cases and I guess have been on lockdown. So I guess I just wanted to, kind of confirm that with you guys and if you know how the virus got there or where those cases could come from.
So that relates to a personal care home?
Yeah, this is Preston Park 2.
Yeah. So I don't have the details, but and I may ask Scott to speak further. But again, our strict guidelines around screening residents when they are admitted to a personal care home or a long-term care facility, strict health checks on staff. While visitation is allowed, visitors have to go through a health screen as well. That has served us really well. We have not seen the large, devastating outbreaks in our long-term care facilities and personal care homes that many jurisdictions have seen, and we really need to adhere to all these best practices. Having said that, we do occasionally see an event where, the virus could have been introduced either by a resident being transferred from another facility, a staff member, or a visitor. And then the main emphasis is to quickly screen all residents and staff that I would expect is happening right now in that facility to see if there's any further transmission and to isolate people who may be positive. But I'll ask Scott if he has any further information.
Thanks, Shahab. The only two clarifications I'll make is that the facility is not a personal care home, but it's a seniors assisted living facility, so it's a private facility. It's not under the umbrella of the Saskatchewan Health Authority. I am aware that there were two positive cases, but I don't have information yet on the contact tracing or follow-up, or in particular the transmission of the cases and where it came from.
Thank you. Nicole, do you have a follow-up?
Yeah, I guess I'm not sure if you're able to answer this. You just said you're still doing contact tracing, but I guess is there any possibility, we know that Preston Park 2 is very close to Market Mall. Is there any chance that it could be linked to that? We know that's kind of a popular spot maybe for people to hang out, whether it's high school students, seniors. I guess, is that a possibility? And also, as a side note, is this now considered an outbreak because there are two cases there?
So for the first common ground, whether it's an outbreak, I think we will have to wait for the initial assessment. Usually in any institutional setting, like a long-term care facility, personal care home, two or more cases are an outbreak. An assisted living facility like Scott described, it's more of, there may be independent housing units, so we'll have to wait for some further information. And of course, as all of us are out and about, whether it's shopping malls or food courts or other settings, our general risk level does go up, and that's why it's really important that we, practice all the measures we do. But in many cases, when we have an initial case, which is a sporadic case, it is difficult sometimes to identify the source of transmission. And currently, about 1 in 5 cases that present on a weekly basis, we can't identify that. Where the exposure was, and that's why we have to be vigilant all the time. And then most of the cases currently have been linked to outbreaks in Saskatoon, Yorkton, and now in PA. So, but the sporadic transmission does happen in 1 of every 5 cases now, about 20%, and that's why we have to practice, get good hand hygiene, staying home if we're unwell, wearing a mask in an indoor public place, maintaining the physical distance all the time when we're out and about. Thank you.
Thank you, Doctor. We'll go to the next caller on the line. Moderator?
We have Britton Gray with CJME.
Hi, I'm just wondering, with Thanksgiving here, what's your concern over there being a rise in cases, just as some people might have those family gatherings and everything?
Yeah, so we have put online our fall guidance, and it really does stress that we be very diligent with keeping our numbers small. The safest option is to have a Thanksgiving meal with your immediate household, connect virtually with other friends and family. If you do plan to invite people over, it's preferable that they be limited to your, extended household, friends and family, the same consistent small group up to 15 people that you meet regularly. And even then, if someone is not feeling well, either as a host or a guest, there should be no hesitation in canceling the event or not attending an event. In this time, we absolutely don't want someone who's unwell to be the host or a guest, where you can then get quick transmission in those close, intimate settings. The limit for gatherings otherwise is 30, but that should only be done if you have enough space where members who are not part of the same household are able to physically distance from other households. So I think we need to be cautious, vigilant, certainly celebrate Thanksgiving virtually with other families. If you do want to invite people over, keep it to the bare minimum from your extended household and follow all the general precautions.
Thank you. Any follow-up, Britton?
Yeah, we're seeing kind of cases with unknown transmission has been rising quite a bit recently. Your thoughts on kind of this, and if this is something we should definitely be keeping an eye out and have a little bit of concern over?
Absolutely. That's a really important metric that we are following. So 3 weeks ago, about 7% of our cases had no link to a known case. Then it went up to around 12% 2 weeks ago. Now it's around 18%. So this is very important. When we see more cases proportionately that don't have a source of exposure, it means that it's being acquired in the community setting from someone who themselves weren't aware that they were unwell. And we know that a small proportion, especially of younger adults, can be asymptomatic, about 20 to 30%. And that's absolutely the reason why we have to practice all the other things, not just not going out and about if you're unwell, but when you're feeling well and you're out and about, physical distancing, mask use when you're indoors in a public place, and hand washing are critical to keep our case numbers low. Thank you.
Thank you very much, Doctor. I believe we have one more caller on the line. Moderator?
We have Guy Quenville with CBC.
Hi, thank you. We're hearing about a case potentially at Balfour Collegiate in Regina. I'm wondering if you can confirm that and what you can tell us at this point about that.
Okay, unfortunately, at this point, I do not have that detailed information, but obviously we do receive, the school board does receive notification when there's a case linked to a school, and then, of course, letters go to parents in the classroom impacted, and further information is shared with all persons in the school. I'm not aware at this point of a case in Balfour, but we can certainly update at a later time, or the school division will certainly, I assume, update as appropriate. Thank you.
Follow-up, Guy?
Yeah, thank you. This is about the PA Gospel Center outbreak. This morning, Scott Moe was asked about the outbreak, and he mentioned that there may be interprovincial travel involved in that outbreak, and I'm just wondering if you can confirm that and what all you can tell us about that factor at the moment.
Yeah. So initial investigations yesterday did suggest that there were some speakers who may have come from Alberta or Winnipeg. I did alert my counterparts late last night, and as we get more information, that information will be shared with Alberta and Manitoba so that they can follow up in terms of ensuring that individuals who participated are isolated and if symptomatic are tested. But at this point, it appears that there were individuals who participated from, not too many, a few from Alberta and Manitoba.
Thank you. I think that'll conclude our news conference for today. Thank you very much. Please note that these are scheduled for every Thursday afternoon through October, but we will hold additional availabilities as required by events. Thank you, Dr. Shahab, and thank you, Mr. Livingstone. Have a good afternoon, everyone.